Hey guys, today we are talking about the pelvic floor. So the pelvic floor is a group of muscles that lives on the bottom of the pelvis. They play a few different roles for us in our day-to-day function. So one being the control of our bowel and bladder habits, and the other ones being kind of support for all of our internal organs. So that's going to be bladder, bowel, uterus, and all those other organs that tend to live and hang out right in the pelvic area there. Some things you might notice if you do have some sort of dysfunction going on at the level of the pelvic floor might be something like you leak a little bit of urine when you laugh, cough, sneeze, run, or lift. You might notice that you have some discomfort with intercourse that might be like kind of really painful. You also may notice some things like pressure, fullness, bulging sensations, especially when you're sitting or standing for long periods of time. So all of those things will be a direct result of the function of the muscles. So just like any other muscle in the body, the muscles might be a little bit too weak, not have good endurance, not have good coordination, or they might be too tight and causing pain because of that. So that's really where the physical therapy comes in. So you'll come in for an evaluation. We can chat about all of your symptoms, all of your past medical history, and things that might play a big role in that. And we'll also figure out, do you have an issue with strength, or do you have an issue with hypertonicity or really tight muscles? And we'll figure that out together. And then we'll be able to give you the best exercises for that. So nice breathing and mobility work for those really, really tight muscles, and some good strengthening for those muscles that might be a little bit weak and not doing their job for you. And that doesn't mean just Kegels. We really take a whole body approach to every single one of our patients, but especially our pelvic floor patients. We would never just focus right here. We're going to incorporate hips as well as core to really make sure that all those muscles are working together for you so that you're not losing urine when you want to go for a run. But if any of those symptoms sound like you, feel free to come on in. Obviously, there's more that I did not list here. So if you think you might have something going on with the pelvic floor, come on in, we'll get you checked out, and we'll get you back on the road to recovery.